Later, we will have a question and answer session. If you wish to ask a question, please press 1, then 0. I'd now like to turn the conference over to Supervisor Hilda Solis. Please go ahead.
Thank you, and good afternoon. I'm Hilda L. Solis, Chair Pro Tem of the Los Angeles County Board of Supervisors. I want to thank you for joining us for today's press briefing. As you'll hear from our Public Health Director, Dr. Barbara Ferrer, we are again at a critical juncture. COVID-19 cases are increasing. Hospitalizations, ICU stays, and use of ventilators are all going up at a concerning rate. Modeling suggests that 1 in 140 Los Angeles County residents are currently infected with COVID-19 and infectious to others. Only 2 weeks ago, it was 1 in 400 Los Angeles County residents who were infected. I want to be very clear about this. COVID-19 affects everyone. It's not limited to people over 65 or those who have medical conditions. Instead, we continue to learn about young people having severe health impacts from COVID-19. Our youth are our future, and I want to speak directly to them. We need you well and healthy, and we need you to protect not only the health of your families, but that of yourself, because our world depends on it. Please take this seriously. This extends to wearing face coverings. The evidence is very clear now that if everyone wore a mask and continue physical distancing, our infection rates would go down, and that would allow us to reopen our economy. But wearing it below one's nose or scrunched under one's chin is not doing you or anyone any favors. It's not fashionable, and certainly it's not the appropriate use. Please wear your mask so that it covers your mouth and nose, and that is the only way it works. I urge you to encourage others to do the same. And I also want to remind residents that gatherings remain prohibited. I know it's challenging to be away from family and friends, and the urge to see people is hard to resist. But this can be a matter of life and death. Even if gatherings is in one's backyard or limited to only 2 households, the impact can be severe. Please find other ways to stay connected. For example, through writing letters or emails to friends, dropping off groceries to your parents' doorstep, or as simple as calling your friends and family. This is how we stay connected and how we stay healthy. I know that the anxiety many are facing is debilitating. It has resulted in loss of sleep for some and lack of nutritional food for others. I want to remind everyone of the importance of sleep, nutritional food, and keeping healthy. Although those with healthy immune systems are not immune to COVID-19, it is true that our bodies need us healthy to combat the virus. Please get rest, eat vegetables, exercise, and keep your immune systems healthy. And lastly, I want to provide a brief update on the action the Board of Supervisors took yesterday, which was coming up with a plan to close Men's Central Jail within 1 year. The LA County jail system is not only the largest, but has also been ranked as one of the largest mental health facilities in the country. Jails are no place, absolutely no place for anyone with the mental health needs to be in. Instead, they should be in a therapeutic setting, not a punitive one. Closing Men's Central Jail will further the county's commitment to Care First and Jail Last model. For years, those working to reform the criminal justice system have emphasized the need to close this jail, and the COVID-19 pandemic has not only magnified but also reaffirmed the need to reimagine public safety and public health in LA County. With the closure of Men's Central Jail, we'll be able to assist our most vulnerable community members by shoring up resources for our health system at a time when such added investment is clearly needed. I want to thank all of you, and I would now like to introduce our Public Health Director, Dr. Barbara Ferrer.
Thank you so much, Supervisor Solis, and to the entire board for your leadership and unwavering commitment to our residents, particularly to the most vulnerable throughout this pandemic. And good afternoon, everyone. We are, as Supervisor Solis noted, at a very critical juncture in our pandemic. We're entering a phase in which we're seeing community spread and hospitalizations like we saw in late April, and what we hoped would be the height of infection here in LA County. But as you've noted this week with us, our cases are rising, the rate of infection is increasing, and the number of hospitalizations are up. And today we're even seeing a small increase in the number of deaths, although this is a data point that usually lags behind all others. Tragically, we do expect that more of our loved ones and our neighbors may die of COVID-19 in the coming weeks with all of the increases we're seeing in hospitalizations. Because of the deeply concerning trend that we're seeing, I want to go straight today to the daily report on deaths and case counts, and then offer some broader context that helps us put this data into perspective. I am sad to report an additional 65 deaths today. 34 of the people who passed away are over the age of 65, and 33 of the people over the age of 65 who passed away had underlying health conditions. 23 people who died are between the ages of 41 and 65, and 13 of the people in this age group had underlying health conditions. 5 of the people who died are between the ages of 18 and 40, and 4 people in this age group had underlying health conditions. Information on the 3 deaths that's reported by the City of Long Beach are available at longbeach.net. This does bring the total number of deaths in LA County to 3,642 people. 93% of the people who have died from COVID-19 did have underlying health conditions, but a full 7% of the people who passed away did not. And when the numbers get as big as they are today, that 7% represents dozens and dozens of people who may have thought that they were at no risk for having serious illness and even dying for COVID-19. But unfortunately, this virus can affect many, many different people. For the 3,389 people who have passed away where race ethnicity data has been identified, 45% are Latino Latinx, 27% are white, 16% are Asian, 11% are Black, less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. We're also reporting 2,496 new cases today. This brings the total number of cases in LA County to 123,004. These cases include 4,690 total cases reported by our partners in the City of Long Beach and 1,415 total cases reported by the City of Pasadena, both of which have independent city health departments. We're also reporting 759 confirmed cases among people experiencing homelessness. Among these cases, 277 were referred to isolation and quarantine sites to appropriately isolate for the duration of their illness. 2,004 confirmed cases of COVID-19 are people who are currently hospitalized. 26% of the people who are confirmed cases are in the ICU, and 17% of confirmed cases are on ventilators. We've also investigated a total of 841 residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. Currently, there are 645 active institutional investigations, but we have closed 196 investigations to date. Residential settings, as I've noted, include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. Non-residential settings include workplaces, food and retail, and educational settings. The total number of confirmed cases in institutional settings is 20,714, and that includes 12,424 cases among residents and 8,290 cases among staff. And I'm really sad to report that 1,885 residents in institutional settings have died from COVID-19. 1,696 of the people who passed away resided in skilled nursing facilities, and we extend our heartfelt condolences to all the family members who have lost loved ones. Of the 62 newly reported deaths today, 6 were among people who lived in our assisted living, in our nursing facilities. We're also reporting 3,217 confirmed cases at some point in time in our jail facilities. 2,900 were among people who are incarcerated and 317 among staff. The Sheriff's Office is reporting today for their facilities 59 inmates who are positive, 80 people who are incarcerated and have recovered, 88 inmates that are in isolation, and 2,935 people who are incarcerated that are quarantined. There are 185 cases in the state prison, 128 are among people who are incarcerated, and 57 are among staff. And there are 756 cases in the federal prison systems, 741 among people who are incarcerated, and 15 among staff. And our number has stayed steady at 75 cases in the juvenile facilities, 27 among youth, and 48 among staff. There now have been 1,229,072 people that have been tested and had results reported to the LA County. 9% of all of the people who have been tested have been positive. But the 7-day average of the daily positivity rate has now climbed to 10.4%. And as you all know, we do watch the daily metrics very carefully, and we share them with you either here or online every day. But it's also important to see them in the larger context of 7-day trends. So I do want to provide a brief update now on some of the indicators we're tracking and the changes that we're seeing over time. Please pull up the first slide. This graph shows the 7-day average of daily reported new cases of COVID-19, which, as you see, continues to significantly increase. At the beginning of June, we were averaging 1,300 cases a day, and now we're averaging 2,400 new cases a day. This daily average paints a very clear picture of what has been happening over the last few weeks, which is that here in the county, we are seeing a sharp increase in community transmission. I'll take the next slide, please. This slide shows the 7-day average of the daily percent of positive tests over time, which also, as you can see, from a low point in early May, is now increasing steadily. At the beginning of the pandemic, when we were mostly testing people who were sick, our positivity rate was about 15%. That's back in early April. Now, even though we're testing many asymptomatic people and close contacts, our positivity rate has increased to about 11%. The next slide, please. This slide shows the past 3-day averages over time of daily COVID-19 patients that are hospitalized. And this should be a concerning slide for all of us because it does show that we've had a significant growth in hospitalizations that is continuing, even if you see a slight dip for the last couple of days. Our 3-day average of people being hospitalized is now at over 1,900 patients. And this is more people hospitalized each day for COVID-19 than really at any other point in the pandemic. We'll take the next slide. And this slide looks at the past 7-day average of daily deaths. And you will note, fortunately, and we're so grateful for this, that deaths are on a downward trajectory. But because this is a lagging indicator, we are worried, given the higher rates of hospitalizations, that deaths may go back up, which would be so unfortunate for us to witness here in our county. The next slide. We always want to make sure that we're tracking deaths and hospitalizations and cases by race and ethnicity so we can address head-on issues of disproportionality. And as you'll see, the greatest burden of the number of deaths experienced here in LA County continues to occur among our Latino and Latinx communities. And while you see declines in the death rates for all races and ethnicities, unfortunately, the rate of decline among Black and Latinx, Latinos, has not been as much as that we've seen among our white residents. Next slide. This slide shows what we call the death rate. This is where we compute the number of deaths over the number over 100,000 people in each population
Latin is a classical
group, which allows us to do more comparisons. And you'll see that, again, this is frightening in the growing disproportionality that's experienced by blacks and Latinos here in LA County. You'll notice that the highest rates are among our Latino friends and neighbors and in their communities, followed very closely by the experience of blacks and African Americans. And it also shows that if you look at data by the poverty rates in communities, communities with high levels of poverty continue to have 4 times the mortality rate of communities with little or no poverty. As I've noted for the past weeks, the data is alarming. The fact that the gap that we have not been able to narrow this gap is a cause of concern, and it means that we need to redouble all of the efforts to make sure that access to testing, healthcare, support services is there, but we also need to be very mindful of protecting workers, often who may be in job situations where they're not getting the protections they need to protect themselves, both at work and then again to protect their community and their families when they go home. These trends that we see do help us see the big picture of how COVID-19 is affecting our residents and our communities. And with that in mind, I'm pleased to announce that we've just launched an updated data portal that should make it easier for the news media, for our members in the community, for healthcare professionals, researchers, to be able to get accurate and up-to-date information on what we're seeing across the county, especially at this very critical juncture. It's designed to display the key data points, including important 7-day averages that we look at every day. We hope that the graphic and accessible format of this webpage will assist you in understanding the big picture of COVID-19 conditions here in the county. And as with all of our information, you can access it at publichealth.lacounty.gov. I do want to mention that we have some encouraging news that I want to be able to share because at this time we know how important it is for all of us to work together if we want to continue to get back on track and slow the spread of the deadly virus. And I'd go on to the next slide. I'm really glad to report that from what our inspectors were able to observe over the 4th of July holiday weekend, businesses and residents seem to be embracing the responsible actions that are so essential to our recovery. Our inspectors were out this weekend and they found significant high rates of compliance to prevent the spread of COVID-19. And this, in fact, is a different picture than what we had seen earlier. Now, I want to be clear that this is just a sample, and it doesn't give us the full picture of what's happening all across the county, but they do show major improvements over the samples that we had seen before, and we do hope that these efforts can be sustained. Inspectors visited 1,101 restaurants between July 3rd and July 5th. And they found that 99% of restaurants were complying with our order to only provide outdoor dining, takeout, or delivery. 98% were complying with all of the physical distancing requirements. 99% of customers were appropriately wearing their face coverings, and 82% of employees were wearing their appropriate face coverings, which included face shields. The 82 bars that were visited were all closed, as were the 8 breweries and wineries that were visited. In addition, the inspectors visited 74 hotels. 90% were complying with the physical distancing requirements, and 97% were complying with the wearing of face coverings. And I'm so grateful for all the cooperation we're seeing from both businesses and residents alike, because it's encouraging to note that this is a county where when people put their mind to it, they actually make sure that something good happens. So my message to all of us who call LA County our home today is a plea to keep up the good work that our inspectors saw out there over the holiday weekend. Continue to avoid the 3 C's: crowds, confined spaces, and close contact with people you don't live with. Stay home if you can as much as possible. If you need to go out for work or important errands, please wear your face covering and wear it correctly. It should cover both your mouth and your nose. If you don't wear a face covering correctly, it protects no one. And remember, even though we all miss the way it used to be, it still isn't safe or smart to return to seeing friends and family we don't live with. You could be infected without knowing it and pass along a virus that could be fatal to someone you love. This awareness, the knowledge that we truly are our sisters and brothers' keepers, gives us the power to slow the devastating spread of the virus. And I now will turn it over to my colleague, Dr. Christina Galley, the Director of the Department of Health Services.
Good afternoon. I want to first talk today briefly about testing access within Los Angeles County, and then I'll shift to talking about the hospital bed demand projections that the Department of Health Services has been working on over the past several months. First on testing access. As all of you know, testing appointments are booked for the remainder of the week in Los Angeles County. This issue is affecting both the city-funded, the county-funded, as well as the state-funded testing sites, as well as many sites that are operated by private providers and pharmacies and clinics who post their testing access points on the county and city website. I know this is concerning to many people, so I want to provide some clarification about what's going on and what can be done about it. First, appointments are at capacity for a few reasons, both because several city and county-funded test sites had reduced testing availability over the July 4th holiday weekend for planned closures. This shortage of testing and the reduction in testing access was not, contrary to some news briefings, was not because of any test kit shortage or because of any resource shortages. Second, the mismatch between supply and demand in the testing sites recently is also because we've seen a huge spike in the number of patients who are seeking access to testing. And there's a broad desire for individuals to get tested, to know if they might have COVID, to know if they might have been exposed and are test positive. We think this is the major factor that's driving that mismatch. That said, especially given the rising test positivity rate that Dr. Ferrer just mentioned, which is exceeding 10%, the county is working to address this in a few ways. First, we are adding additional slots to existing test sites wherever possible. Second, we're working on standing up new county-funded test sites, which will be stood up over the next 2 to 3 weeks. We're focusing on particularly vulnerable areas, focusing on some of those areas geographically that Dr. Ferrer mentioned that have disproportionately high mortality rates, have documented low access to testing, and have documented high test positivity rates. And third, DHS continues to work with providers to be able to establish new testing access points for the community as well as for their own individual patients. In the last 3 weeks, 18 new sites were added on the county's website as access points for the general public through this private and public provider system. This is in addition to testing sites that were stood up within the established healthcare system and that are not listed on the county's website. While the county is committed to ramping up testing broadly, I know that we can't do it alone, and I'm grateful to the cities that have stepped up to use their federal stimulus funding as the county has to support testing access. Support from the state and the federal government will also be critical as we navigate the road ahead, especially to troubleshoot a few issues. First, supply chain concerns and shortages, funding and reimbursement support, and clarity about who needs to be tested, particularly in the setting of potentially constrained supply chains. As we face what's ahead, though, it's important for us to consider the role of testing in the fight against COVID and really think about who needs to be tested. So let's back up a little bit. So in medicine, many tests, as you all know, are used to inform treatment. As just one example, if you have strep throat, you go to the doctor, you test positive for strep, they'll give you an antibiotic, and this cures you of the infection, and it helps prevent the downstream complications of strep throat. Unfortunately, for COVID-19, there is no medicine that is proven to improve outcomes among an outpatient population, so among a population that is not hospitalized or is not sick enough to be hospitalized. We also use tests to identify people who have the infection so that we can help prevent them from spreading it to others. And this is then, in addition to testing people who are in the hospital and are seriously sick, this is the main indication of testing for COVID-19. But as we've learned, an individual is most infectious before they are symptomatic, and some spread the virus despite the fact that they never have symptoms. They remain asymptomatic their entire course. So taking this into account, we have to remember a couple of things about what a test can and cannot reasonably do. A test reflects whether or not you are likely to have the virus only on the one single day on which you were tested. This means two things. One, even on that day, your test could be wrong. All tests, including COVID-19 tests, including tests that are approved by the FDA and have generally good test characteristics, all tests can be wrong, and you might have a false negative. Second, even if your test is correct, which most tests I would say are, and even if it actually is negative today, that only means that on the day that you were tested, you were negative for the virus. It doesn't mean anything about the next day or the day after that or the day after that. Obviously, taking this into account, is it's really not feasible or realistic for testing to be done given the status of laboratory capacity in the United States on a scale or scope that could allow us to identify everyone who has the virus every day. This is not a sustainable testing approach. These basic facts about how the virus is spread is the reason why public health authorities and our own LA Department of Public Health does not recommend testing among a general asymptomatic population. Finally, please remember that you should not be expected by your employer to get a negative test in order to return to work. This strategy of testing for return to work, whether or not you had COVID previously, is not recommended by any public health group at the local, state, or federal level. While the county and the health system in general are working to ramp up testing, it's very likely that in the days and the weeks to come, testing access will continue to be insufficient to meet the demands among all of those who want to be tested, particularly if the supply chain becomes increasingly constrained as we see other states also ramp up their testing access. In managing this, we'll be turning to our knowledge about the virus to offer guidance. So I'll ask you to think about four things. First, learn the Department of Public Health criteria for who needs to be tested. There's 3 general criteria. People with symptoms. If you have symptoms, you absolutely can get a test, but I would always encourage you to discuss your specific situation with your provider. Second, people who live or work in high-risk congregate settings. Testing is key in these settings because the risk and consequences of transmission is so serious. And third, if you're a known exposure to someone who tested positive for the virus. This is the type of testing, as I mentioned, that's critical for public health purposes to be able to trace contacts and identify those who might transmit the virus to others. The second thing, if you are experiencing symptoms of COVID-19, you need to isolate yourself. Keep your physician informed about your symptoms. If you're elderly or you have underlying health conditions that put you at serious risk of bad outcomes from COVID-19, we especially want you to discuss with your physician and seek medical care early so that you can be properly cared for. If you don't have a physician, you can obtain one through the county or through a number of community clinics. If you don't know where to go, you can call 211 for connection to a physician. And obviously, if you are having trouble breathing or you're having serious symptoms at the moment, please call 911 or go to the nearest emergency department. The third thing, if you were exposed to someone with a known infection, then you need to quarantine yourself for 14 days. This is irrespective of whether or not you got a test, and even if the test is negative. A COVID test should never be used to end that 14-day quarantine early. The final thing is that health officer orders are there really to allow us to reopen safely, to allow us to get back the businesses going, get people back to work, to try to reopen society, but do it in a way that controls the virus and reduces transmission. In keeping this in mind, remember a negative test can never reassure you that you have not been exposed, and it can't reassure you that you won't be positive tomorrow or the day after that. Given that, a negative test should never be used as a free pass to engage in social activities that aren't otherwise recommended. and it's not a ticket that would allow others to think that they're safe to interact with you. It is not safe. I know we all want answers, and that's natural as part of being a human, but please realize that a COVID test should really, in very many circumstances, not change your behavior with respect to interacting with others outside of your household, and should not change your need to quarantine or isolate if your conditions fit the need to do so. I'll shift now to talking about the hospital bed demand model. Before we go through the slides, I just want to acknowledge that COVID-19, as I think we can all affirm, that it makes us feel like we're on a bit of a roller coaster, and a roller coaster that's in the dark. We can't see what's ahead, but we know that there's dips, shifts up, shifts down, inclines, falls, and leveling off, and each week the numbers seem to change. We are all in this time of uncertainty together. The purpose of the modeling effort, though, is to inform us, and importantly, to help prepare the hospital systems for what might come ahead, taking into account the full range of potential possibilities regarding the demand for hospital-level services, even when that potential range is broad. Turning to the slide, before looking at this week's data, I want to take a step back and remind you of what we showed you last week with respect to uncertainty and how we use that to predict what lies ahead. In this slide from last week, we showed the model's predictions regarding the range of possibilities for the number of daily new cases of COVID-19 that require hospitalization. The model uses data on the recent number of new daily hospitalizations of patients with COVID-19. This is shown by those white dots, and it uses that to determine what rate of transmission was occurring in the communities a few weeks, generally 3 or so weeks prior to that. The increase in daily hospitalizations seen between June 15th and June 25th told the model that that effective transmission number, or that R, had increased a couple of weeks, a few weeks prior, because it takes that few weeks for individuals to infect others and then for those people to be sick enough to need to seek hospitalization. Based on the model's estimate of R from a couple of weeks ago, the model makes a prediction for the range of potential possibilities moving forward. And importantly, it does so while assuming that the R from a couple of weeks ago has continued to stay constant. The important thing to understand is that the range of possibilities that are predicted is shown by that full red area and not the single white line. Rather, the single white line in the middle of the red shaded area is not one single prediction. It is just the middle road in what is a range of potential future possibilities. So starting this week, to avoid confusion, we've removed the white line from the graphics because it's easily misinterpreted as being a single expected prediction rather than what the slide really is, which is a range of patterns that the model believes are all possible. In the next slide, in contrast to what we showed you last week, there has been, thankfully, a leveling off in the number of daily new hospitalizations with COVID-19 among the 70 911 receiving facilities that report their data to Los Angeles County. However, realize these numbers are still at an all-time high, as Dr. Ferrer mentioned, and this is cause in and of itself for deep concern. As you can see, the number of new cases is actually lower than the edge of the red shaded area from last week. This is because recall that that red shaded area shows the range of possibilities under the assumption that the R from a couple of weeks ago stayed the same. The fact that the number of cases didn't go up as much as the R didn't stay up. It went back down as shown on the next slide. This is a good thing. The next slide shows the changes in R, that effective transmission number over time, that explains the ups and downs and the leveling off that we've seen in the daily new number of cases. And as you can see, the R went up in the first half of June and is now hovering at around 1. 1 is really a turning point in the epidemiology of how we consider this virus and the trend of cases. If you're at 1, very small differences make a huge potential change in the model and in what we might see in reality. Because if you're more than 1, then the number of cases will steadily increase over time. And if you're less than 1, then the number of new cases will steadily decline. An R of 1 a couple of weeks ago is why the number of new cases appears to be leveling out, but at a much higher level than the daily cases that we saw and were reported in May. Again, the reopening order for certain businesses started in late May, and with reopening comes a reduction in social distancing and physical distancing, which causes transmission. We believe this was the main cause for that uptick that we've seen. Finally, on slide 8, the bottom line of what this means practically is that we do believe still that our hospital system, even at those higher bands of uncertainty, is still prepared and able to care for the expected and potential incoming number of patients who need care for COVID as well as non-COVID related illnesses. However, if transmission again rises, then we could see numbers of patients that could still put a strain on our hospital system. This is well within that red range of uncertainty and should be a stark reminder of the need for continued vigilance with following public health measures. It is important to note a few other changes in what we're seeing on the ground in the hospitals and that we're working to capture in the model. So a couple of things. ED volume is up. We had seen it be down in April and in May. ED volume is back up. It's back up for a number of reasons, but it's also up and increased significantly with patients presenting with COVID-like symptoms. Many of these people, thankfully, are not sick enough to need to be hospitalized and they can go home. However, they may not be tested in the hospital since they're being discharged home, and so they might not be reflected in the case counts. Rather, they're being sent home, as I mentioned, to isolate at home for the full duration of the need to isolate based on their symptoms. Many of these people are also younger and healthier, and they don't have underlying health conditions. Their bodies are thus better able to fight the virus, and that's why we don't see the same high hospitalization rates among that ED group. But that doesn't mean that they themselves can't become very sick. Certainly some are and will. And at the same time, it doesn't mean that those people can't go on to infect others. If they're interacting with people who are elderly or who are more vulnerable because of their underlying health conditions, then they can transmit the virus to others and put them at great risk. So all of this means that we need to continue to work hard to stem transmission of this virus, and that what happens in our hospitals really reflects what's going on in our communities. We are all on this roller coaster of COVID-19, and the only thing that we can control right now is how we limit our interactions with others, how we physically distance, and when we wear our masks, which should be every time we leave the house. This will be our reality for a while, but if we stay the course, keep the R low, can keep the transmission down, then we can save lives and maintain our hospital system for all those who need it. We're now ready for questions.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1, then 0 at this time.